Stop tinnitus now. I want to show you a simple hand method you can do anywhere that many people report quickly reduces the ringing. I'm Dr. Alan Mandel, and if that constant high-pitched noise is stealing your focus or your sleep, I understand how frustrating that feels. Millions struggle with tinnitus, and while we can't promise a guaranteed cure, this four-step, non-invasive hand protocol may help calm the signals your brain is hearing. It's safe when done carefully, it uses only your hands, and I'll walk you through every detail and the exact rhythm I use in my clinic. Before we start the hands-on work, a very brief plain language primer on how hearing works so this makes sense. Sound travels into the outer ear, moves the eardrum, then the tiny bones of the middle ear pass those vibrations into the cochlea, that spiral organ in the inner ear. Inside the cochlea are microscopic hair cells that turn vibration into the electrical signals your brain recognizes as sound. When those hair cells are irritated or damaged, the brain sometimes interprets that as ringing. But there's another piece many people overlook: the middle ear pressure system, the eustachian tube, and nearby neck muscles and nerves. Changes in middle ear pressure or tension around the mastoid and base of the skull can distort the way sound is transmitted and can make tinnitus louder or more persistent. If this is resonating so far and you want practical hands-on guidance like this, tap subscribe and save this video. I'll keep these step-by-step tools coming. Now let's get into the 4 steps. I'll describe exactly where to place your hands, how to move them, the counting rhythm I use, it's easy to remember, sets of 10, 10 slow, then 10 fast, what sensations you might feel, and important safety rules to follow. Visual close-ups will appear on screen so you can match placement. We'll also show on-screen countdowns for each set. Safety first. Wash your hands thoroughly, remove jewelry, and use the fleshy pads of your thumbs, not your nails. Wipe away any oil from your ears or thumbs with a tissue so you don't slip. Never push deeply into the ear canal. Only shallow, gentle contact with the outer canal is allowed. If you feel sharp pain, bleeding, sudden hearing loss, or discharge from the ear, stop immediately and seek medical attention. Step 1 targets the suboccipital ridge, that little bony shelf at the base of the skull where your neck meets the head. Place both thumbs just under that ridge where you feel the bone behind your skull. Hands are relaxed, fingers supporting the base of the head. I want you to do a gentle inward and upward pressure rhythm. Count aloud with me. 10 slow presses. 1, 2, 3, up to 10, at a steady, relaxed pace, about 1 press every second. Then immediately do 10 faster, firmer, but still gentle presses. 1, 2, 3, up to 10. That's your set. 10 slow, 10 fast. Repeat once or twice more if it feels comfortable. Many people report a tingling or a sense of increased alertness in the scalp or behind the ear. The idea here is gentle stimulation of the small nerves at the skull base and a subtle mechanical effect on cerebrospinal and venous flow that may calm aberrant nerve firing. Remember, thumbs only, no digging, and stop if anything hurts. Next is the ear grab and forward pull. Use the index and middle finger to cup the back of the ear and the thumb on the front, or simply place the first 2 fingers behind the ear and the thumb in front, whatever feels secure and comfortable. Grip the fleshy part of the ear, the helix and lobule, not the cartilage near the canal, and pull gently forward and slightly outward. Again, count 10 slow pulls, 1 per second, then 10 faster pulls. Think of a smooth, consistent tug, not a yank. You may feel warmth, a sense of pressure change, or a subtle drainage feeling into the throat. This motion can help mobilize the eustachian tube and normalize middle ear pressure for a brief period, which often reduces the perception of ringing. Keep movements controlled. If the ear is sore or tender, skip this step and consult a clinician. The 3rd step is the external auditory canal thumb push-pull. For this one, use the fleshy pads of both thumbs and touch only the outer entrance to the ear canal, not inside the canal. Place your thumbs on the tragus and the area just outside the canal opening, so you're essentially creating very light inward pressure on the outer ear, then gently pull back. The motion is a shallow push in, then a pull out. Again, 10 slow, soft in, soft out, then 10 fast, a slightly quicker in-out. On screen, you'll see a close-up showing a safe, shallow depth. Visual cues will mark the safe zone. People commonly describe a popping or suction sensation, sometimes a brief relief as pressure equalizes. Do not insert thumbs beyond the natural rim of the ear, no sharp pressure, and no nails. The fourth and final step focuses on the mastoid area, the bony bump behind your ear where neck muscles attach. Using the knife edge of your hands, the outer edge along the pinky side, place that edge just under the mastoid process and perform an upward stroking motion toward the base of the skull where the sternocleidomastoid muscle attaches. 10 slow upward strokes, then 10 faster strokes. Keep movements firm but gentle. This technique addresses tension in the neck muscles that influence the auditory system and stimulates local blood flow. You may notice a sensation of pressure change, warmth, or improved circulation around the ear and jaw. A few practical pointers as you perform the full sequence. Breathe slowly and evenly, don't tense your shoulders, and keep your jaw relaxed. Use visual on-screen counts. The rhythm is your mnemonic. 10 slow, then 10 fast for each step. If one step gives you clear relief, it's fine to repeat just that step a second time, but avoid overworking any spot. For most people I work with, doing the full 4-step sequence once daily provides a measurable improvement. Some prefer to repeat it up to 3 times a day when symptoms are worse. Try this routine for a few days to a week before deciding how well it works for you. Outcomes vary. Many report immediate reduction in volume or fewer spikes. Others notice gradual improvement over days. Why might this help? The mechanisms are plausibly a mix of pressure equalization, gentle stimulation of the small sensory nerves around the ear and skull base, improved local blood flow, and temporary recalibration of the somatosensory input that can influence auditory perception. In plain terms, small, controlled touches and movements can change what the ear and nearby nerves are signaling to the brain, and that can quiet the internal noise for a while. These are plausible effects based on anatomy and clinical observation, but they are not guaranteed cures and not a substitute for medical evaluation when red flags exist. Red flags you must not ignore: sudden or rapidly worsening hearing loss, severe pain, bleeding, persistent discharge, dizziness with loss of balance, or visual changes. These require prompt medical attention. If you have implanted devices in the ear, a history of ear surgery, an active infection, or are on blood thinners, check with your physician before trying these maneuvers. If any maneuver causes sharp pain, stop immediately. A few hygiene reminders again. Use the pads of your thumbs, keep nails trimmed and away from the ear, wipe oils from your hands and ears with a tissue, and don't insert fingers deeply into the ear canal. On screen, you'll see overlays that say Safe Zone, No Deep Insertion, and a Stop If Pain banner to reinforce this. If you try this, keep a simple log. Note the time of day you performed the routine, which steps felt most helpful, and whether the ringing reduced in intensity or frequency. Try it consistently for 3 to 7 days to look for a real trend before determining usefulness. Many patients report fewer spikes in tinnitus and improved sleep within that window, but individual results vary. I want to close by saying you don't have to accept constant ringing as something you just live with. Gentle, well-directed manual work like this can often reduce symptoms and give you a tool to use when things get loud. It's safe when done as I described, but it's not a replacement for medical evaluation when needed. If you found this useful, please try the method for a few days and come back to comment below with your experience. Let others know which step helped you most. Share this video with someone who's struggling with tinnitus. It might be the practical thing they can try right away. If you want more step-by-step self-care techniques for ear and balance complaints, subscribe and I'll put more evidence-based, safe options out regularly. Take care, be gentle with your ears, and remember, small, consistent actions often make a big difference.